He joins us now. Professor Khangelani Zuma is one of the principal researchers in this report. Thank you so much for making the time to come through. Prof, the report has been published since it's the fifth one now.
Since 2002.
Can you give us a sense of the changing trends? Is it worrying, or are there any things to celebrate, any pointers to celebrate?
Thank you very much. I think it is befitting for me to say that the first survey done in 2002 was actually made possible by Nelson Mandela Foundation. So it's really befitting given what we're celebrating as
it is relevant
today.
And appropriate, yeah.
And the work has been going on over the years. As you remember, we've been seeing an increase in HIV prevalence in the country, and also people dying out of because of HIV and AIDS. But over the years, we've been seeing a change. More or less like a decline in HIV infections or people dying from HIV because people now are being put on treatment. And that is what we see with the results, that more and more people being put on treatment, therefore the numbers that are dying from HIV has been reduced. However, having more people on treatment whilst others, most likely who are not on treatment, have high levels of viral load, continue to infect other people, that is contributing to the additions of people that newly get infected with HIV. That has led to where we are with the epidemic.
Let's just go back to how the survey is constructed. Does it give a clear view of reality?
The survey, it's a very large survey. It's one of the biggest surveys that one can conduct, where we go to a total of 15,000 households in the country. In each and every household that we visited, we invite everyone to participate. Almost 40,000 South Africans, to which we are grateful for their agreeing to participate in the study, agreed to participate in the study. And out of those, almost 24,000 of them provided blood specimen for HIV testing. And we also then test whether those that are infected with HIV were recently infected or it's a long-term infection, so that we can be able to estimate the numbers that recently get infected with HIV. And we have seen since 2005 that the numbers that recently get infected with HIV have been going down, and we are standing at 231,000 people that got infected in 2017. That number is still very high if we are to win the fight against the HIV epidemic.
Is it justified or unfair to put the conversation at the door of men to say sexual behavior has to change? Or is it a universal societal conversation that needs to be had?
Partly males are responsible, but remember, HIV transmission is between two people. And therefore, it's everyone in the society is responsible to reduce.
But just in terms of power dynamics, are you able to research such that point? What power do women have in terms of deciding how and where and how we're going to go about having a sexual relationship?
It exists, and that is why the challenge that we face is that we see more and more younger girls, 15 to 24 years of age, having sexual contact with older males. Mm-hmm. And that has been established that in those relationships, negotiation of safe sex becomes very difficult. Yeah. And more so, most of those males who are 25 years and above, we found that they are living with HIV. They do not know that they are living with HIV, and therefore most of them are not virally suppressed and therefore very infectious. And that has led to these high levels of HIV infections among young girls.
Unpack what you spoke about earlier, the usage of treatment to get better versus the new infections coming in, and how we can find a way to bring, to harmonize this.
Yeah. Like I said, the dynamics of HIV epidemic is controlled by two things. We've got a group of people that are living with HIV, and then from those people living with HIV, we've got those that are on treatment who therefore live longer and therefore are preventing people from dying. So we're maintaining that cohort of people living with HIV.
Yeah.
However, among those people that are living with HIV, there are those that are on treatment who are most likely 87% of them are virally suppressed. So they are less infectious, which means they are not stopped, the infection doesn't stop, but it's less. But we've got another pool of people, of which out of 7.9 million people, only 62% of South Africans are on treatment. Now, the other pool that is not on treatment is very infectious. That means when they have a sexual contact with a person, the risk of transmitting HIV to those that are HIV negative is very high, and they keep contributing to new infections, and we're preventing deaths on one side by putting people on ARVs, and hence this continuous increase in the numbers living with HIV, which we need to stop.
One of the things the survey seeks to do is to find out to what extent your respondents are exposed to national HIV/AIDS communication. What were your findings there?
We found that people that are exposed through media sources, through information, actually they are more likely to know their HIV status, they are more likely to take responsibility as far as their sexual behavior is concerned. And therefore it is very important that we be aggressive in educating people about the risk of HIV. And education is not an event, but it's a process which doesn't have an end point. It needs to continue.
Absolutely, but are you able to compare to what extent the people who are knowledgeable and have information, how they use that information in terms of their behavior?
Given the fact that those that we see that who are exposed to knowledge based on all the other media sources, they are more likely to know their HIV status, and they report fewer sexual partners. It clearly shows that when we educate people, they respond. So ours is to make sure that we educate people, and we make sure that those males, a big group of them who are living with HIV, who do not know their HIV status, get to know their HIV status, get tested, and then they be put on treatment to reduce these high levels of HIV transmission.
Another point that you were investigating is drug resistance. It's a conversation that we've had a lot in terms of TB, and it's now moved into the HIV realm. What were your findings there?
At the moment, the data or the testing on drug resistance is still being processed. As soon as the results are available, we'll have a conversation about them.
What are the kind of conversations we're not having around this? The report is about prevalence, but what about impacts?
Yeah. The issues that we've been seeing on prevalence, for example, that the young girls all along have been having very high levels of HIV prevalence. However, the young boys in the age of 15 to 24 years, for many years, their prevalence has been lower than the young girls. And the young girls having prevalence that comparable to older age group, which shows that intergenerational sex. However, in this survey, we found that young boys in the age of 15 to 24 years, all of a sudden their prevalence is increasing. And the other worrying factor is that in all age groups from 2012 to 2017, when we compare, the levels of new infections has been decreasing in all age groups. However, only among boys in the age 15 to 24 years, we see an increase. So if you look back now in all the program, the interventions, the focus has been more on young girls, but it's clear that we need to focus on every component, young girls, young boys, older males, especially those that are having sexual contact with younger girls.
You set the tone for the conversation, started talking about Nelson Mandela Day and how Mr. Mandela was the one who started the survey. The President Barack Obama yesterday spoke about the importance of young people, the upcoming generation, in terms of taking the continent forward. How will this impact the prevalence of HIV/AIDS in young people? How will this impact on their ability to build a new South Africa, to build a future Africa?
We all need to understand that we're the masters of our own destination. And also we need to understand that the state, for example, can provide methods of, for example, methods of prevention, like can make condoms available for use during sexual intercourse. However, it is our responsibility to make sure that they are used during every sexual activity. And also it is our responsibility to make sure that there is no other person that gets infected with HIV because of you.
All right, we're having a conversation with Professor Khangelani Zuma, who is one of the authors of the HIV/AIDS prevalence research coming from the Human Science Research Council. But what we're asking you today, and that's the topic of the day, our South African viewers can call on 01171468441, international callers on plus 271171468441, and the poll is around this conversation we're having. Are we winning the fight against HIV/AIDS? 47% of you say yes, we're winning the fight. 53% say no, we're not, and 497 of you have already voted, and we encourage you to continue voting. Prof, 47% have a sense that we're winning the fight, but is that the sense you get from your results?
We are getting there, but we are not anywhere near winning the fight against HIV epidemic if what is happening continues. Where I would say we need to continue getting more people on treatment, but we need to remember that treatment only reduces, or it prevents you from dying from HIV and AIDS related death. But infections would still continue if we are not protecting ourselves and others from getting infected with HIV. So we still have a long way to go, but we are in the right direction.
Let's take a look at some of your tweets. At Lechasamolo7 says, no, we're about to. Majority of young girls are taking sex as a hobby. They're dating sugar daddies. They're dropping out of school and varsities. They are a lost generation. They're doing sex without protection. At Unati_007 says, we're not winning anything against AIDS. Look at the statistics. Hashtag HIV survey. And at Berry Martin 1 says, we cannot win the battle against HIV/AIDS because the majority of people are living like HIV/AIDS does not exist. Now, Prof, the conversation is a parallel one. On the one hand, the behavior, the sexual behavior of South Africans, but on the other hand, the advances in science, and from the Human Science Research Council, you're exposed to those advances. How can science help us in this fight?
Science has shown that, for example, circumcision does reduce the risk of contracting HIV. However, it needs to be understood that being circumcised does not mean that you are protected. You will never get infected with HIV. It reduces, but it doesn't stop. The second part is research has shown that when we put more people on a treatment, we are reducing the pool of people that are likely to infect others. However,
so the viral load
gets to be down so low to be maybe undetectable. However, reducing those levels, it does not mean
it doesn't exist.
Stop. It does not mean that you cannot transmit. It just says the risk of transmitting from one person to another, it's still there, but it's low. And therefore, we should not be complacent and say that I am on medication and therefore I cannot transmit. That is wrong.
Outside of the release of the survey, what kind of conversations can we continue to have about HIV/AIDS?
We need to talk to our older males to stop having sexual contact with younger girls. We need to continue talking to our older males to get to know their HIV status. If they are positive, they need to be put on treatment immediately. We need to speak to our young boys and young girls to take responsibility. We need to talk to them. Let's have a conversation to them about the risk of having early sexual intercourse. You run the risk of getting infected with HIV, other STIs, and having early pregnancies at the age where you are not ready or even financially stable to be able to sustain them.
Thank you so much for coming through to talk to us. Professor Khangelani Zuma is from the Human Science Research Council. Blaine?